My name is Hakan Yusal. I'm a board certified plastic surgeon. Lower extremity reconstruction, usually a patient that sustained a lower extremity injury or maybe a tumor that is being removed from the lower extremity causing a deformity or dysfunction of the lower extremity. We are usually consulted by other doctors to help this problem and to help the patient. Many patients are seen in the hospital if it's a trauma case because it can be an orthopedic problem with open fractures, or it can be a tumor problem that it was arising from soft tissues or the bone. So we work hand to hand with other specialties. These specialties being orthopedic surgeons or trauma surgeons or vascular surgeons. What we try to do is we try to reinstate the function of the lower extremity with tissue transfer or repositioning of the tissues on the lower extremity. Defining the injury is basically we see them in the hospital. We know exactly what we are dealing with. What is the missing part? What is the function missing? Is there a bone missing? Is there a muscle missing? Is both missing? Is there a vascular compromise? Is there nerve issues? So this is a multi-level problem. It's not like simply skin is missing or just muscle missing. So we have to reconstruct this composite construction, which means the nerve, bone, soft tissue, and vascular construction. So we are microsurgeons. We are microsurgically trained. We are microvascular surgeons. So most of the time, the defect that is in front of us needs to be reconstructed by a tissue transfer from another part of the body, which means we may need to borrow a muscle from the abdomen, from the back of the patient, or from the upper thigh, and bring to the lower extremity and connect the muscle and the vessels together in the lower extremity under the microscope. This is the first stage, to cover the bone or to cover the open wound. But it usually is not finished there. Once the wound is covered, now the tendons needs to work. Now the nerve needs to work. So that means that we are going to need rehabilitation. We may come back for tendon surgery and reconstruct those tendons so foot and ankle can function. And then also we will look into the nerve issues. How is the sensation in the area? How is the motor nerves working? Is there anything that we need to do? Of course, the next will be, is this reconstructive procedure doing the purpose, which means that patient is he going back to work? Is he not going to work? Or if he is working, can he fit in clothing? Can he fit into shoes? Can he fit into his regular duty clothes? So we have to work all these issues one at a time. This surgery, lower extremity reconstruction, is a very big surgery, which means that it's a multi-team, multi-surgeon. We are a bunch of doctors in the room with them because we are going to do orthopedic work, we are going to do microsurgical tissue transfer, plastic surgery team will be in the room. So a lot of people coming and seeing the patient and interviewing and getting signatures and all that stuff. So it's a little bit, for the patient, a stressful situation. But what we try to do is in advance, try to tell every step of this procedure and explain and make them understand that what they're going to have, how it is going to be done, and why it is done. So the day of the surgery, patient is basically comes to the operating room. Usually if we work with orthopedic surgeon or vascular surgeon, the other team starts first to do their own job because our job is to come and cover whatever they did so the patient's wound is covered. And it's going to be an 8 to 10 hour day surgery. Outcome of lower extremity usually depends on the injury or the defect that we are handling. If there is severe nerve injury or severe bone gap, usually these patients will need more than one surgery. That means that they're going to come back for additional reconstructive procedures. If the simple thing is just to cover a wound, then the function will be retained and they will be fine and they will be done probably 6 to 8 weeks. But if this is more than that, most of these patients will need more than one surgery. The goal of the lower extremity reconstructive surgery is to get the patient back to their daily life, back to their work, and make sure that they are pain-free.